Do you ever get that clicking or popping sound in your jaw? Or maybe you wake up with a sore, tired jaw that just won't quit? If that sounds familiar, you're not alone, and today we're diving deep into what might be causing it, TMJ. So, what exactly is TMJ? Well, TMJ stands for temporomandibular joint. It's the hinge that connects your jawbone to your skull, right in front of your ears on both sides. You can feel it working if you place your fingers there and open and close your mouth. This little joint is a powerhouse. It lets you talk, chew, and yawn. But when things go wrong, we call it a temporomandibular disorder, or TMD. People often use TMJ to refer to the disorder itself, and that's what we'll be talking about today. TMD can show up in a lot of different ways. The most common sign is pain or tenderness in your jaw. You might also hear clicking, popping, or grinding sounds when you move your mouth. For some people, it can even feel like their jaw is getting stuck or locking open or closed. The pain isn't always just in the jaw either. It can spread to your face, neck, and shoulders, and even cause headaches that feel like migraines or earaches and ringing in your ears. So, what causes this frustrating condition? Experts say it's often not just one single thing, but a combination of factors. One of the biggest culprits is clenching or grinding your teeth, something we often do unconsciously, especially when we're stressed or even while we sleep. This is called bruxism, and it puts a ton of pressure on your jaw joint and the muscles around it. Think about it, your jaw muscles are some of the strongest in your body. If they're constantly tense, it's no wonder things start to hurt. Another common cause is an injury to the jaw, the joint itself, or the muscles of your head and neck. This could be from a heavy blow or whiplash in an accident. Even something as simple as opening your mouth too wide for too long, like during a dental procedure, can sometimes trigger TMJ issues. Arthritis can also play a role. Just like other joints in your body, the temporomandibular joint can be affected by osteoarthritis or rheumatoid arthritis, causing the cartilage in the joint to break down and lead to pain and stiffness. Sometimes, the small disc that acts as a cushion inside the joint can slip out of place, which also causes those clicking sounds and pain. Even your posture can contribute. If you're constantly slouching at a desk or staring down at your phone, it can strain the muscles in your neck and shoulders, which in turn can affect your jaw muscles and put pressure on the TMJ. It's all connected. Now for the good news, there are many ways to manage and treat TMJ pain. And most people can get relief with simple, conservative treatments. You don't always have to jump to invasive procedures. Let's start with some at-home care you can try right away. First, give your jaw a rest. Try to stick to soft foods for a few days. Think smoothies, yogurt, soup, and mashed potatoes. Avoid hard, crunchy, or chewy foods like tough meats, nuts, and chewing gum. This gives your jaw muscles a much-needed break. Also, try not to open your mouth too wide when you yawn or sing. Support your chin with your hand if you feel a big yawn coming on. Heat and cold packs can be your best friends. Applying a moist, warm towel or a heating pad to the side of your face for about 15 minutes can help relax tight muscles. If the pain is sharp and feels more like an injury, a cold pack wrapped in a thin towel for 10 to 15 minutes can help reduce inflammation and numb the area. You can alternate between heat and cold throughout the day. Gentle jaw stretches and exercises can also make a big difference. One simple exercise is to rest your tongue on the roof of your mouth, just behind your front teeth, and gently open and close your mouth a few times. Another is to slowly and gently move your jaw from side to side. The key here is gentle. If any exercise causes more pain, stop immediately. The goal is to improve your jaw's range of motion without straining it. Managing stress is huge when it comes to TMJ. Since teeth grinding and clenching are often linked to stress, finding healthy ways to unwind can provide a lot of relief. This could be anything from meditation and deep breathing exercises to yoga, regular exercise, or even just setting aside time for a hobby you love. Whatever helps you relax will also help your jaw relax. If these home remedies aren't cutting it, it's time to see a professional. Your dentist or doctor is a great place to start. They can properly diagnose the issue and rule out other problems. One of the most common professional treatments is a custom-made splint or mouthguard. You typically wear it at night, and it fits over your upper or lower teeth to prevent you from clenching or grinding. This takes the pressure off your joint and allows the muscles to rest and heal. It's very different from the over-the-counter sports mouth guards, as it's designed specifically to reposition your jaw. In a more relaxed state, physical therapy is another fantastic option. A physical therapist who specializes in TMJ can teach you specific exercises to stretch and strengthen your jaw muscles. They might also use techniques like manual therapy to gently mobilize the joint, or treatments like ultrasound or low-level laser therapy to reduce pain and inflammation. They can also help you correct your posture, which, as we discussed, can be a major contributing factor. In some cases, your doctor might recommend medications for short-term relief. Over-the-counter pain relievers like ibuprofen or naproxen can help with pain and swelling. If the pain is more severe, a doctor might prescribe stronger pain relievers, muscle relaxants to help with clenching, or even certain antidepressants that can help control bruxism and pain in low doses. In some instances, injections like corticosteroids or even Botox can be used to treat inflammation and muscle tension, but these are usually considered when other treatments haven't worked. Surgical options are really a last resort, reserved for severe cases where there is a clear structural problem in the joint that isn't responding to any other treatment. These can range from minimally invasive procedures like arthrocentesis, which involves flushing out the joint, to more complex open joint surgery. But again, the vast majority of people with TMD will never need surgery. The key takeaway here is that you don't have to just live with jaw pain. Start with the simple, gentle approaches. Pay attention to your habits. Are you clenching your jaw while you work? Are you chewing gum all day? Making small changes can lead to big improvements, and don't hesitate to seek professional help. A proper diagnosis is the first step toward finding the right treatment plan for you. Remember, if you're struggling, talking to a healthcare professional is always the best course of action. If your pain is causing significant distress, know that help is available. Thanks so much for watching today. I hope this gave you a clearer understanding of TMJ and some practical steps you can take to find relief. If you found this video helpful, please give it a thumbs up and subscribe for more health and wellness content. Drop a comment below if you have any questions or your own tips for dealing with jaw pain. Take care, and we'll see you in the next video.